The movie we chose for our project is K-Pax. It's about a man who calls himself Prote, who was admitted to the Cincinnati Psychiatric Institute in 2001 after telling police that he's an extraterrestrial from the planet K-Pax. Prote is very convincing and has a vast knowledge of astronomy, which astonishes a group of astronomers he presents new information to. While institutionalized, the other patients are drawn to Prote, and he helps some of the patients with their conditions through self-discovery. Prote tells his psychiatrist, Dr. Powell, and the other patients that he'll be returning to his home planet at 5:51 a.m. on July 27th, and tells them that one of them will be able to accompany him back to K-Pax. Dr. Powell believes this is an important date in Prote's life and attempts to identify him before it's too late. Through psychotherapy, Prote is found to be Robert Porter, who discovered his wife and daughter savagely murdered on July 27, 1996. The man who killed them was still in the home, and Robert broke his neck, then attempted suicide by jumping into the river behind his home. He was presumed dead until now. He was institutionalized for a month before Dr. Powell took over his care. He originally was thought to be intoxicated on hallucinogens, but blood tests were negative for any drugs. A thorough assessment, including a brain scan, showed no physical abnormalities, such as temporal lobe issues or brain tumors, to explain his behavior. He was unresponsive to 300 milligrams of Thorazine daily after 3 weeks. He also showed no response to Haldol. At the end of the movie, Robert Porter is found catatonic under his bed at a stated departure time, and another patient, Bess, is found missing.
If you'd like to come in now.
Actually, my name is Prote. Robert is just my friend who I come to this planet to help occasionally. Whew, I forgot how bright your planet is. And this fruit, it is amazing.
Well, I apologize. My name is Kayla. I'm going to be your nurse today, and if it's all right with you, I'm going to ask you a series of questions, get to know you a little bit, okay?
Certainly, that's fine.
All right. So first off, can you tell me where we are?
Yeah, of course. We're at the Cincinnati Psychiatric Institute, and you're Nurse Kayla, and you think I'm crazy.
Well, I wouldn't say you're crazy. I prefer ill. Do you believe that you're ill?
Maybe a little homesick occasionally.
Homesick. Can you tell me a little bit about your home?
Well, I live on a planet called K-Pax, capital K hyphen capitals P-A-X. It's on your constellation Lyra, about 1,000 light years from here. I traveled here through light.
1,000 light years. So, if you traveled here by light, can you tell me more about this?
Well, actually, you humans are eons away from discovering light travel. If I told you anything, you would just blow yourselves up. So I can't really divulge any information right now.
How about a demonstration?
Sure.
Okay.
Adios. Aloha.
And you just traveled by light?
Yep, I'm back.
Interesting. So if you traveled here by light, if you don't mind me asking, what is your age?
Well, I am 374 of your Earth years old.
Oh, wow. Okay. So, Prote, correct?
Correct.
What do you do for a living on K-Pax?
Well, money is more of a Class BA-3 planet issue. K-Paxians don't require money.
BA-3, can you elaborate a little bit more on that?
Yes, you're on the early evolution cycle and your future is unknown.
Interesting. Okay. So, Prote, can you tell me a little bit about your family?
Well, family is more of a non sequitur on K-Pax. Families are not really recognized.
So, if there's no families, how do you procreate, if you don't mind me asking?
Very carefully.
Can you tell me a little bit more about this?
Well, it's like having your nuts in a vice, except your entire body feels this. And there's a feeling that you Earthlings equivalent to nausea mixed with a terrible odor. And the climax is like getting kicked in the stomach and falling in a pile of mott droppings.
Mott droppings, what is this?
Well, a mott is a being similar to the Earth representation of skunk, except much more potent.
Oh, that sounds terrible, I can understand. So, if you don't have a family, do you live alone or do you share your home with other people?
No, 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 no. You're not really listening to me. Again, family is a non sequitur on K-Pax, as it is on most planets. We don't live with others.
Okay. Since you're so technologically advanced than we are, do K-Paxians have any form of government or societal structure?
No, government is really not a necessary thing. No laws, no lawyers.
If there's no laws or lawyers or no government, how do K-Paxians, let's say, know what's right from wrong?
Kayla, every being is born knowing the difference between right and wrong.
Okay.
The nursing diagnosis for this patient would be disturbed thought process. The goal is by the end of the 2 weeks, the client will recognize and verbalize that the false ideas occur times of increased anxiety. The interventions that we have decided to do were convey acceptance of the client's needs for false behavior and indicate that you do not share the belief. The rationale for this is because the client must understand that you do not view the idea as real. The second intervention is do not argue or deny this belief. Use reasonable doubt as the therapeutic technique. I understand that you believe this is true, but I personally find it hard to accept. The rationale for this is arguing with the client or denying that the belief serves no useful purpose, because delusions, ideas are not eliminated by this approach, and the development of a trusting relationship must be implemented. The third intervention would be reinforce and focus on reality. Discourage long run-in about irrational thinking. Talk about real events and real people. The rationale for this is to discussions that focus on false ideas are purposeless and useless, and may even abrogate the psychosis.
Okay. So, Prote, at this time, after discussing everything with your doctor and going over the notes, we've decided that, first off, we're going to discontinue your medication regimen of Thorazine and Hadol due to the fact that you had no effect to the medication. We would also like you to follow up with psychotherapy 3 times a week. And I'd like to try some hypnosis where we put you under sleep and to get to know a little bit more about who this Robert man is. I know I've called you Robert a few times and you said he's a friend, so I'd like to get to know him. We would also like to, for community resources, refer you to some housing, also a job, and since you say you're so technologically advanced, I'd like to get you in a job maybe geared toward technology, something that interests you. We'd also like to get you on some food stamps until you're able to get on your feet. And you know what, I think at this time we're going to just meet at least once a week, reevaluate, and go on there and see how your prognosis is.
Certainly, Kayla, I will be happy to please you. I just want you to know that I will be leaving this planet on July 27th.
Okay.
So you have me until then, and I will do whatever you would like, and it's worth it just to eat some of this produce that you have here.
All right, thank you.